See, in India, the lasers, the first workshop was done in Sanjay Gandhi in 1996. And at that time, we were debating in our mind whether laser can do prostatectomy or not. Now, during the last 15 years, that scenario has totally changed. And now it is well established that, yes, there is a place for laser prostatectomy. Now, the problem has come that the question which is commonly asked to me by so many urologists that which laser to buy. And as you see in this slide, there are different kind of lasers are available in the market, and really it is very confusing for the urologist to decide which one to buy. Now, to understand this, it is better to know little bit of the basics of the laser, and this slide just to show you the evolution of the laser prostatectomy. The laser started in 1917 on the Einstein, this is quantum theory of radiation, and the first medical laser was the ruby laser in 66. Parson was the first urologist experiment with the laser lighting in bladder, and then this Mulwani in 68 did the laser lithotripsy, and after that in 1993 Johnson, he described the laser visual laser evaluation of the prostate, and this was done with the Nd:YAG laser, and this I will talk little bit later on. Then Munster in 95 described the interstitial laser coagulation, and then Peter Gilling is the one who has described this technique of the laser resection, followed by laser enucleation of the prostate in 1996, and that has revolutionized the management of the lasers. And now we have got these new lasers, KTP, biolytic, thulium, and erbium is also in the pipeline, and there are many more coming. Now the question is laser prostatectomy. Laser word is very fancy. Every patient wants to get a laser prostatectomy without understanding what can be done. Same applies to some urologist also. So let us understand. Laser can do coagulation of the prostate. Laser can do cutting, resection, or enucleation of the prostate, and laser can do the vaporization of the prostate. So there are different lasers for the different purpose. Now this is the spectrum of the wavelength electromagnetic, and this one has to understand that the lasers are here between 514, start 532 onwards, and they go up to 2001 according to the wavelength of the laser. Now this is the quality. The lesser the wavelength, there is more absorption in the blood, and more the wavelength, there is more absorption in the water, as a result of which the penetration of the laser is less if the wavelength is high, and penetration is more if the laser has got a lower wavelength. And this shows the effect on the tissue. And now this is the depth of penetration. KTP 0.8 millimeter, diode 5 millimeter, Nd:YAG 10 millimeter, holmium egg laser 0.4, and CO2, which is used for the open surgery. Now this is the problem with the Nd:YAG laser. It gave rise to more of the coagulation, and that is the reason why it went into disrepute, and actually that's delay of onset of the laser prostatectomy because of the use of this Nd:YAG laser. And then KTP has got a depth of penetration of 0.8 millimeter, so it has got more property of the going deep and giving rise to vaporization of the tissue. Holmium egg laser is more superficial. And these are the different kind of lasers, and they are the uses. And CO2 is basically used in the open surgery. Pulse dye laser, alexandrite for the stones, and this was the beginning of the lasers. KTP can be used only for the prostate, diode only for the prostate, Nd:YAG for the soft tissue and the prostate, and holmium egg laser is the one which can be used for the soft tissue, for the prostate, and for the stones. And then thulium is only for the prostate, erbium is only for the stone. So according to you have to decide what will be the indication in the place where you are working, what kind of cases you want to do with the lasers. Now Nd:YAG laser, just like to mention that because of the poor outcome, this is totally out. Interstitial laser also, it has not given good results, so this is also out. Nobody practiced this, and this is the way it was done. The holmium egg laser, this is one which is the pulsed laser. Now please remember this word, because there are thulium laser which is a continuous wave laser. Now this is the only difference between the holmium and the thulium. Now it is a pulsed laser and it has got a zone of thermal ablation 0.5 to 1 millimeter. It has excellent cutting and precise ablation properties. Weber bubble at the front of the fiber, initially photomechanical effect, tearing tissue apart, following by tissue vaporization. Now because of this pulsed laser, when these vapor bubbles are formed, there is a water storm or snow clouds type of picture comes in front of you. So therefore your vision goes out, and that is the reason why initially when you start using the laser, there is a more difficulty in understanding the anatomy. Then you have to stop, everything will settle down, then you again start. So this is the problem. That's why the learning curve is higher in the holmium laser. And then Peter Gilling is the one who popularized this laser. And this holmium laser prostatectomy, you can do a transurethral incision of the prostate. Suppose you have a small gland, there is no need to do a full resection or HoLAP. You can only make an incision, and this can be done as a daycare or outpatient procedure. You can do a holmium laser ablation of the prostate, HoLAP. Now the same company, they started with the HoLAP and they changed over to HoLAP. Now this is again the problem of the marketing and all those kind of things, because when you are doing the laser ablation, you have to use a side fiber, and side fiber every time you have to use a new fiber. So the cost of the treatment goes very high, and vaporization is not that effective as the enucleation of the prostate. So again this procedure has come, but it is not very popular. Holmium laser resection of the prostate for those who do not have the morcelator. So initially Peter Gilling started making the small chips of the prostate. Later on, once you have the morcelator, then the procedure of the choice is the holmium laser enucleation of the prostate. And according to this list, the learning curve is more difficult as you go down in this slide. And this is the instruments which you have already seen. Now there are different kind of fibers. We have a 200 micron fibers, 365, 550, 550, 850, and we have a 1000 micron fiber. Now here the 200 micron fiber is used for the flexible ureteroscopy, and then 365 is used for the ureteroscopic with semi-rigid for the ureteric stone. 550 micron fiber is used basically for the prostate. We can also do with the 1000 micron fiber and fiber, but normally in all over the world the 550 micron fiber is preferred, and this is the side fiber 1000 micron, which can be used for the ablation of the prostate. In our practice, what we have done, we have got this side fiber, and once the tip is burnt, you can cut this fiber, and same fiber can be used for the further like a end fiber, and you can continue to use this fiber also. So this is the way you can make up this cost of the side fiber. And now the other question commonly asked to us is this: how many watt machine you want to buy, whether it's a 20 watt, 50 watt or 100 watt. Now depending upon the type of use, if you are doing soft tissue, then you can use only 10 to 12 watt. For the stone, normally we require only up to 20 watt machine actually. You don't need more machine than 20 watt, except for what Dr. Heminder Shah has showed you, that bladder stone. Even I have done large number of large bladder stone, and if you are doing a bladder stone, then your power can go up to 80 watt. And believe me, then it becomes very fast and you can finish your job in a short time. Bladder tumor 10 to 20 watt, because one can do the laser resection of the bladder tumor also. This may come in some other lecture. And for the prostate, I think so minimum wattage you need 50. You can do with 20, 30 also. I have also tried, but it will take long time. One should not forget that the duration of the procedure is equally important, because some of the complications of the TORP or holmium laser, you are using a resectoscope sheath which is in the urethra. So the longer the duration, those kind of complications of stricture, infection, they all will be same whether you are doing TORP or laser, depending upon duration of the procedure. So if you are using 50 watt, you will take more time. If you are using 100 watt, then it will be very fast. The problem is that your experience. Now if you are using 60 or 80 watt, then you can go slowly. So in the beginning, when you start learning, start with the lower watt, and when you are become experienced the surgeon or the receptionist at that time, you can change over to 100 watt. I know all these 3 persons sitting here, they are very expert and they are using 100 watt, but normally one can do is 80 watt and 100 watt. One thing more, sometime depending upon where you are resecting, if you are coming close to the virum montanum, put down your wattage. At the end of the procedure, when you achieve coagulation, put down your wattage lower to 60 watt or 80 watt. So this is flexible between 50 and 100. One can adjust according to the area where you are working and what use you want. And this laser lithotripsy has significantly changed the endoscopic management of urinary calculi, able to fragment all types of calculi, precise control during the fragmentation, minimal propulsion or movement of the calculus during the treatment, and this is one of the significant advantage during the ureteroscopy. Otherwise, lithoclast, your fragments can go up into the kidney. Small fiber allow use with any endoscope, and small fibers are more flexible. And you can do all bladder, ureteric, pelvic and calyceal stones, and this is the different ways how you do the fragmentation of these stones. Now coming to the other lasers which are available today. Now this is the 532 titanium phosphate laser or the green light laser. It is selectively absorbed by hemoglobin and small optical penetration depth into the tissue. Confinement of laser energy to a superficial layer of prostatic tissue that is vaporized rapidly and hemostatically only with 1 to 2 rim of coagulation. So this is the advantage with this laser, that the vaporization is more than the coagulation. There's a long history here also for the green light laser. They started with 60 watt, which was not successful. Then they came down to 80 watt. Now they have launched 120 watt, and recently I heard that they are coming out with 180 watt machine. So the message is very clear that still we don't know what is the correct wattage which one has to use for these kind of lasers. And this is the green light machine which you all know. Now this is in this procedure only the vaporization is done, and effective for any size of the prostate as the claim by the company, can be done as a daycare procedure. And here is some advantage which personally I also use. If I have a patient who is on anticoagulant or a very high risk patient, I want to be a safe surgeon. So I will prefer to do a green light instead of taking the risk of going for the holmium laser or bipolar TURP. However, the cost is a very deterrent factor for the use of this kind of laser. Now this is about the holmium laser. It has got the same wavelength as holmium laser, but it is a continuous wave laser. Now this is one of the advantage of the holmium, that the fiber don't have no movements at the tip, so you have a steady view in front of you. It is easier to learn to do this type procedure. The rest of the benefits are more or less same as for the holmium laser, but only you cannot do the stone with this kind of laser. And this is the biolytic, this is the diode laser, and again they have different wattage. They started with low to 150 watt machine, and they claim that peak power of 300 watt. This is the 980 nanometer wavelength, provides the highest combined absorption in water and hemoglobin. It has got excellent vaporization and hemostasis, shortens the treatment time, but I do not have any personal experience with this laser. Now this is the international conferences. We have all these kind of debates whether one should do enucleation or vaporization. As I mentioned you that companies promote both the ablation and enucleation. Now enucleation is done with bare fiber which can be reused, as a result of which the cost is low. Vaporization is done with side fiber, and in large prostate more than one fiber is required. So this will add to the cost of the procedure. And morcellator is required after enucleation, which adds to the operation time and the cost again. You have to buy a separate morcellator. And there is no consensus all over the world between this enucleation and vaporization. Long-term outcome is better with enucleation, but disadvantage is the learning curve. Vaporization is better in patients with bleeding disorder or on anticoagulants, but there is a high cost of the fiber. And one thing we must remember, that large size prostate are coming for surgical treatment. Because of the medical treatment, small glands we are not seeing anymore. We are seeing above 40, 50 or 100 grams, or as you have heard more than 100 and 200 grams. So cost and the long-term durability is the important factor in the developing country, because patients are paying from their own pocket. It is not just by the insurance company or something. And these are some of the standard disadvantages which we have already discussed. And cost analysis is important. When you go to buy a laser machine, you have to see what is the cost of the laser machine, what is the cost of the consumables which are required with the laser machine, annual maintenance contract. Please don't forget this. And here I want to highlight one more point, that when you are doing laser prostatectomy, you will always need a trained nurse or technician along with you in the operation theatre, which we normally forget, which is very important. You don't know which time there can be a problem in the machine. You may have to put off the machine, put on the machine, and that's why you need experienced person. Second, there should be a person who keeps eye on your surroundings. Your laser fiber, somebody put a foot on the fiber may just break like that. There can be accident. So you have to include that man, one extra person in the theatre. So when you are working out in a big hospital, it's all right, but a small place, you have to think of that. Then this is the one, and the endoscopic equipment and irrigating fluid, which we have already, it will be more or less same whether you use laser and all, but you have to buy a laser equipment when you are doing laser. So which laser machine to buy? It depends upon the quantum of workload in your hospital. If you have a very busy hospital, you have a large number of prostate as well as stone, you can buy 2 laser machines. But if you have got limited number of work, then you can buy the 1 laser machine, and obviously you have to go for the holmium laser, because holmium laser is the one which can be used for all resection, ablation, vaporization of the prostate as well as for the calculi. So this is a gist which I want to convey. If there is any question, we will be happy to answer you.